If a medical procedure is deemed not medically necessary, then why is the patient on the hook for the bill? Normally, the insurance company would either approve or deny the procedure before it is done. That wait, if the procedure is deemed unnecessary, the patient has several choices: don't have the procedure done, appeal the decision, or have it done knowing that they have to pay for themselves. The difference between the gap of what health insurers should do and what they actually do is so far apart and shameful the limit doesn't exist. But how should a layman be able to know that before consenting to it? You don't, which is why insurance companies have pre-approval processes. However, different doctors can legitimately disagree as to whether a specific procedure or drug is medically necessary. I've never had anything turned down by an insurance company, but that might change as I age. Your care team should do their due diligence to obtain prior authorization. Going through this myself right now. It's taken longer to get my procedure, but we don't want any surprises, so have been double checking that everything is authorized. I got a letter from United Healthcare approving my surgery, but also saying approval doesn't mean they'll pay. What the fuck that means? Who knows? It was a cancer surgery. I'm fine now, and I'm still waiting for the bill. It reminds me of how unlimited doesn't mean unlimited to mobile companies. Now insurance companies can say approved doesn't mean pay evidently. Because our hospital system is not publicly funded, the hospitals are paid by the insurance companies, who are paid by the patient's insurance premiums and copays. Unless healthcare is publicly funded and risk is shared by the general populace, every billing question circles back directly to the patient using this service. Usually, there's an alternative remedy that insurance requires beforehand, i.e. physical therapy, steroid injections, then surgery as a final option if cheaper and less invasive means have failed. On the one hand, doctors and clinics do sometimes defraud insurers by ordering unnecessary tests, procedures, or treatment, or simply billing for services never provided. There was a pretty huge case down in Florida in which a company headed up by good old Rick Scott defrauded Medicare and Medicaid for billions. But on the other hand, the insurers abuse the system that allows them to deny claims for medical necessity, and they get away with it. Well, this is why so many people cheered when a health insurance CEO got gunned down. There's a bunch to that question. If the insurance policy does not require pre-authorization, then it is up to the patient to have the doctor check with the insurance company. It's sort of a circular argument. Generally though, any procedure which is costly should be checked with the insurance company whether you have Medicare or employer insurance. It really sucks. If a service was provided, you are expected to pay for it. You still have to pay for a burger that was made for you even if you didn't eat it all, because you weren't hungry. And most procedures deemed unnecessary by insurance are needed and necessary. They are just looking for an excuse to not pay for them. Luigi Mangini would want me to remind you that insurance companies employ non-doctors to accept or deny claims by determining their medical necessity. Of course, these people aren't doctors or even nurses or anyone with the slightest medical education. Their goal is to reduce the amount of coverage as much as possible to maximize their profits. Because you signed something that said you would pay for whatever the insurance refuses to pay for. I know a lot of people are mad at health insurance companies. I'm just surprised more aren't mad at hospitals, because they are pulling a lot of as well that's bankrupting people. They are the ones requiring signatures on these forms before treatment, then giving treatments that aren't necessary. And they know it. They just want to make the buck. I was with someone in the ER the other day and the staff was insisting she get an MRI for brain injury. She kept telling them she never hit her head on anything, and they wouldn't listen. She finally had to pitch a fit and demand a different doctor to examine her and tell them to chill, that she had no signs of concussion and she never hit her head. Insurance doesn't like paying for things. I had to fight my insurance tooth and nail for them to consider paying a $200 bill for, get this, talking to my cardiologist for 10 minutes. They covered every other visit before that, but not that one. Their reasoning: I visited on October 28, and my insurance expired November 21, therefore I wasn't on their insurance anymore, and they couldn't cover it. They literally ignored the bill for a month just to tell me after my insurance expired that I had to cover it myself. Because they contract for the procedure and sign a form saying they'll pay for it regardless of insurance coverage. It's contract law. Look, they are saying not covered. I have fought for all my denials. One was payment to the ambulance that took me, and I have had good doctors who have always helped too. You're right, insurers should put their medical licenses on the line and be sued for malpractice every time quality of life medical care is denied. While this is usually talked about in gray areas, but also think of breast implants or facelifts. Those are medical procedures, but they aren't necessary. Yes, I know in some cases they can be deemed so, but shouldn't the patient pay for those? because the world is ruled by Brian Thompson types and there aren't enough Luigi Mangianis.